Hello, everybody. Welcome to our webinar today, when we're going to talk about how the UK National Health Service is using tin can, and this is going to be a really interesting case study. We've got a great crowd out there. I'll start off. First of all, say good morning to the folks here stateside. Good afternoon to the folks joining us from the other side of the Atlantic. It's great to have such a broad-based audience joining us today. So some quick logistics. My name is Mike Rusty. I'm going to be kicking things off, and I'll introduce our guests here in a moment as well. Feel free to post questions into the chat window in the GoToWebinar panel over here. We always try to answer all the questions that come through. We have a couple people working the chat windows. They'll be trying to answer questions through the chat. We'll also try to save some time to take questions on the broadcast towards the end. And even if we don't get to the questions after every webinar, we always answer all of the questions in writing via email. So feel free to put those things in there and to make this into a little bit of a dialogue. So I want to start by setting a little bit of context, kind of tell you a little bit about where this program came from. And it all started, it's hard to believe now, almost a year ago. We set out a program back in late fall, early winter last year. We called it Watershed First, where we put out a call for early adopters, for innovators, for people who wanted to blaze the trail, and specifically people who wanted to be exemplar adopters of tin can and be able to share that story with the world. And this is one of those case studies that is just now coming out, just now being able to be shared with the world. Richard and Allison, who are joining us here today, have been great partners and great innovators, great technologists who have moved mountains to make a lot of this stuff happen and to really blaze the trail for everybody in the tin can world, start to get these early case studies and adoptions out there. So quick bit of intros. My name is Mike Rusty. I'm your host today, president of Rusty Software and chief SCORM tin can geek. They call me the mascot around here because most of what I do is to do things like this and to share the story of how these adoptions are happening and the big changes that are coming into our industry right now. Joining me, Allison, do you want to say a quick hello?
Hi there, yes, I'm Alison Potter. I'm e-learning program manager in Health Education Wessex, which is towards sort of south of England. We cover about 100,000 healthcare staff across that region.
Great, and Richard, welcome.
Hi, I'm Richard Price. I'm a learning technology manager, and I work in the opposite end of the country to Alison. I work up north near York, and we support probably about 100,000 users as well. Through our various technology initiatives.
Great. Well, I'm going to set the stage a little bit and tell you a little bit about what the Watershed Learning Record Store is and how that's being used by a bunch of organizations, the primary tool that's being used for all of this stuff. Then I'm going to turn it over to Richard and to Allison to kind of tell their story, to share their journey with you, some of the reasons why they were adopting tin can, some of the things they've done with that. After they tell their story, I'll kind of wrap it back up with some key insights and kind of map up their adoption, their architecture to a lot of the things we've been talking about in a very conceptual sense, and show you how they're becoming real right now and how these things are actually being used. So really quickly, what is the Watershed Learning Record Store? At its most basic, the Watershed Learning Record Store is a place to capture all of the data about all of the training and learning events that are happening in your organization beyond just the small fraction of the formal e-learning stuff you're seeing in your LMS. And when we go about having people implement Watershed and to do these early tin can case studies, we take them through a very structured process that we call the Watershed method, where we're encouraging people to always start by asking some specific questions and to focus on gathering the data to answer those questions in a way that can meaningfully impact the business. A lot of the excitement around tin can is all about technology, but it's also, the really exciting things are the business impacts that we're going to be able to have, to be able to move the learning function from a cost center, a thing we have to do, to a strategic part of our employee and talent development stuff. So just kind of go over real quick some of the things people are using a lot of this new technology to do and to track from a capabilities perspective. They're using Watershed to simply track participation across a number of different activities. You're going to see Richard and Allison talk about badging and accomplishments, the ability to define the things that you need to do to achieve an accomplishment and have those things cross many different forms of activities. Lots of people are using these tools for performance observation to see if people are doing the things in the real world that they've been trained to do. We're going to hear a little bit about consolidation of systems as well, the ability to bring data from many, many different systems, the places where learning is happening throughout an entire organization, bring those all into one centralized place and give that data home. There are a lot of people out there using these tools to analyze the competencies and map them out within an organization. The ability to tap into a lot of data, both the breadth and the depth of that data, makes a lot of this stuff more possible now. A lot of people doing population comparisons, looking at how one part of the organization is training versus another part of the organization. Again, just taking advantage of all of that data. Learning path analysis, one of the upcoming webinars I think we've got scheduled, probably the second or third one out, we'll dive into a lot of how there's one organization in the Watershed First program, looking at paths through a simulation and seeing when people are veering off of those paths and where they're veering off of those things. Impact analysis, this will be another one we'll talk more about in a couple more webinars. Looking at, when we make a training intervention, how long does that impact last for? And then, also another big one, people are taking a lot of look into deep dives into assessment data, looking at that in a lot more granularity than they're traditionally accustomed to, regardless of where those assessments happen. So that's kind of the stage. Those are a lot of the things that organizations are doing with Tin Can and with Watershed right now. Those are the big ones, the big trends that we are starting to see. And so with that, let me turn it over to Richard and Allison to kind of tell you a little bit of the story of NHS and where they're coming from and what they've put into place.
Thanks, Mike. That's great. So just to give you a little bit of background, as I think you said already, Alison works in the south of the country in a place called Portsmouth. I work up north in the beautiful medieval city of York. And we came together to come up with a project where we were going to work together and try and implement a tin can solution. So just to give you a bit of background, the NHS is one of the largest providers of health and social care in the world. It's actually one of the top 10 largest employers in the world. Globally, the National Health Service is just about as big as the Chinese Army, the Indian Railways, Walmart, McDonald's. But obviously, in terms of our training requirements, it's a lot more complicated than just training somebody how to make a burger, for example. So we are putting together massive training programs for a really diverse range of different staff, ranging from sort of surgeons through to paramedics, social carers, nurses, and even support staff as well. So there's a huge sort of diverse range of staff with unique training needs, and we can't currently track all of that that's happening. So I think it's really important just to note that what we're going to cover today is about the journey of how we got to where we are. And I know that the use of the word journey is a bit of a cliche, but it has been a voyage to get to this point where we've had lots of late-night sort of coffee-fueled Skype calls with Rusty and with each other to try and bottom out exactly what it is that we want to track and how we were going to do that. So I'll hand you over to Alison now, who's just going to give you a little bit more background.
Hi there, everyone. Thanks, Richard. Yeah, I'm basically our biggest challenge, I suppose, in the NHS is in terms of tracking all of the training and education that's happening across organisations. Probably most NHS trusts or hospital trusts do actually have a learning management system now to do at least tracking of formal training that's taking place in their organisation. Either that's happening formally through face-to-face training or through online learning modules. But as we all know, learning management systems only form part of the picture, really. It only accounts for really a small proportion of learning that's really taking place for that said individual that's being recorded about. Most learning is obviously happening out and occurring out in the workplace. And most of it's self-directed or self-determined. However, it's rarely captured. So, I mean, in our case, or where we were at, was we were simply capturing learning events and not necessarily the learning experiences that people were having. Add to that the very fact the learning that individuals were undertaking is being accessed from a variety of different systems. There's even more complexity. Now, this big apple here, basically across the NHS, we've got a national learning management system, but it's only being used by half of the hospital trusts in the NHS, so about 55% are using the national LMS system. The rest of them are accessing a whole flavour of different learning management systems that range from our Moodles to all sorts of other different learning management systems. This presents a real issue for us in terms of transferability of learning records between those organisations. So we've got a lot of healthcare staff that move between hospital trusts as part of their training, but also throughout their career. So to be able to take that learning record with them is highly important, really. Also, we want to be at a place where actually those learning records could move with an individual between their employment perhaps with an NHS trust, if they're a healthcare professional, but perhaps moving into the care sector. So in particular, we have healthcare assistants that might work in an NHS trust, but then those healthcare assistants might actually move into the social care sector. Now, to be able to take that record with them is something that they can't currently do, and is a limitation of the very fact that we've all got different systems. So the national LMS, our big apple, was really supposed to be able to crack that problem for us, and unfortunately that idea and that vision was never, hasn't really been fully realised, as we can see, and it probably never will, to be honest, because I think most hospital trusts are quite not necessarily wedded to their own systems, but happy with the systems that they have that they're using.
And we've got a similar picture, I suppose, in the north of the country as well. We perhaps have a slightly higher percentage of people using the Big Apple, the Oracle Learning Management System, but the reality is there are these defectors, for want of a better word, using a variety of other learning management systems such as Moodle, Totara, those kind of things.
And this isn't to criticise those organisations for the choices that they've made with regards to a learning management system, or even if they've chosen not to have one. As we know, I mean, as we've already sort of stated, the learning management system only forms part of the picture of somebody's learning anyway. It's just really to raise the point that that they are all using something different. Also, the systems that they're using are using the old SCORM standard, which, as most of you will know, is now 13 years old. And this standard only applies to e-learning and not everything else that people do. I mean, since that time, since that SCORM standard was released in 2001, we've seen the introduction of cloud technologies, we've seen the rise in use and appetite for mobile learning, the use of social learning, and a plethora of other learning systems that are being used. If all of this technology that's being used, if we could actually somehow weave all of the data, the huge volumes of data that are coming in from each of these different systems and different ways of learning, if we could actually weave that into one learning record for an employee, and weave that together with sort of business metrics as well, and performance data, we might actually be able to provide a much more richer and adaptive learning experience for each of our employees. So we're kind of missing opportunities, I suppose, at the moment, if we don't actually look at things in a wider, more holistic sense. So that's where we got to. We basically decided that we wanted to put the new tin can standard to the test and see if it actually could work for us in the healthcare setting, and solve some of these problems.
And that's really where Alison and I came together. So we talked about a journey, and it has been a journey, because we started thinking about how we could perhaps implement this technology and what the business benefits might be, but also what the benefits to learners might be. And this got us thinking about how we could attain the holy grail of learning, which is the Kirkpatrick cycle, level 3 and 4. It means we can actually start measuring the return on business investment rather than just, are the learners happy, are they taking away something from the training. We can actually start potentially capturing that information that gives us that much richer picture of an individual. So we wanted to learn what would happen to those outcomes if we captured the data we were missing, and we thought about incentivizing learners to complete a set of training activities, and even introducing an element of gamification to that, which we'll talk about later, but we're contemplating open badges as well as part of this. So I'm just going to hand over to Alison now, who's going to give you a little background about how her project operates in the south of England, and then I'll give you a bit of background about how our specific watershed project works in the north of England.
Okay, so our proposal and resulting projects down in the south, and actually it probably is very true for Richard's as well, as one in which we hope to be able to identify which learning outcomes have most impact on outcome. Now, we narrowed this down by focusing purely on one of the key priorities now in the NHS, and focusing on dementia and what dementia education is making most impact on patient outcome. And then we further narrowed this down to select a select few sort of learning activities and outcome data that we could capture information and records for. So, as Richard's already alluded to at the beginning of our presentation, is, we spent quite a considerable amount of time getting to this point of actually being able to focus down what it was that our project would be, because when we were learning about the tin can standard, it just opened up so many possibilities. We could have done anything and everything. So actually the challenge for us was really honing those ideas down. So for us, we came up with a fairly discrete set of learning activities and outcome data that we were going to sort of listen to the activity of our staff, and see what they were doing. So we're basically promoting a menu of resources to our staff on our pilot wards. All of the activity that they do, be it the e-learning, be it the simulations that they access, be it the online resources that they access, or even the workplace assessments that they undertake, that we would actually capture information about those into the learning record store. Basically, as staff engage with all of these different types of activities, we've also got the open badges being issued to staff as well. So we've determined different badges for different sets of activities, but kind of using it as a bit of a motivational tool, really, in that if they've accessed 3 or more of the e-learning resources plus a simulation or completed specific competencies outlined in a workplace assessment, then they get issued with a badge. We have sort of a foundation level badge, and then we have some advanced level badges as well. So it hopefully we'll begin to see that actually that the staff that are involved in the pilot feel motivated to come back and do more, because getting these badges, for some it's an incentive. Really, the badges side of things as well, this issue with regards to staff moving from NHS settings, a healthcare setting, to a social care setting, so completely different sort of organisations and structures. If they move between those different sectors, then a badge is something that's, you know, that they personally own. It's not owned by the organisation that they were with. So, you know, hence sort of with learning management systems at the moment, that's kind of data that stays with the organisation. And you know, unless they sort of export that data or transfer it somehow, it doesn't really move with that person at all. Whereas at least with these badges, they're personally owned and can be you know, displayed to prospective employers or the next employer as they wish. Okay. So with our particular pilot, it's running, the first phase of it is running for a period of 6 months. It started at the beginning of June and it ends at the end of December. We've got 2 hospital trusts, University Hospitals Southampton and Portsmouth Hospitals Trust, that are involved in the pilot, and we've only got 4 wards that we've got involved in this. I'm very much a person, I don't like to spread things too thinly. You know, I'd rather us, you know, make sure that we get, you know, a really robust project and people sort of actively engaged as opposed to spread too thinly. But having said that, there's, you know, up to 180 staff that we can engage across those 4 wards in those 2 hospital trusts. And those are multi-professionals. That ranges from your sort of care workers and support workers to nursing staff, also the medical staff as well. So we're not being picky about who wants to be involved in it. It's a voluntary thing, so if they want to get involved, then they can. So what they have to do is at the start of the pilot, they complete a competence and competence survey, which this survey is within the Learning Record Store, so they can access it either on a computer or on their iPad device that we've issued them, and they can complete this very short, I think it's about 8-question competence and competence survey at the beginning of the pilot. They then we then sort of promote basically a menu of resources that they can choose from. So that ranges from a selection of e-learning resources around dementia, a couple of simulation scenario workshops that they can attend, and we've given some suggested online resources and electronic journals that they could access as well. But in the case of the online resources, we can listen and capture information about anything that they want to tell us about in terms of, you know, how that relates to their dementia education. So they've got a little, what we call a bookmarklet that goes into their browser, and as they're sort of surfing the web or accessing a particular electronic journal and think, oh, I want to sort of report to the Learning Records Store that I've accessed this and I want it to count towards my dementia education sort of badge, then they can click the little button in their browser and it automatically knows who they are, what page they're viewing, and sends that information to their Learning Record Store. In the case of the simulation scenario, that is a face-to-face simulation. So they do attend either a simulation suite or it's a sort of reenacted simulation with real patients around sort of dementia diagnostic assessment and behaviours that challenge. Now, how we manage to capture information about the simulation is through an assessment that they complete either during the workshop or at the end, when they say what particular competencies they either observed in the simulation or particular competencies that they actually completed in the simulation. So if they took part actively in the scenario, then they'd be able to say that they completed a particular competency relating to dementia care in their simulation workshop. So we're capturing competence statements from those simulation workshops. Similarly, the workplace assessment is something that the staff can do as and when they wish to, basically updating and informing us and the Learning Records Store about particular competencies that they either observe or complete when they're out in practice. So as they've been issued with iPads, this is something that they can do on the wards, at the bedside, or what we're finding is staff actually go off to a quiet room when they're having a cuppa, and they can go through their assessment, and that triggers tin can statements which are captured within the learning record store. So all of that information is correlated together. Then we've got the little pause, and the survey is repeated. Actually, it says 2 times. When we first set out with this project, we were going to have the survey done obviously right at the beginning, then the middle and the end. We are now just going for beginning and end. They complete that a further time at the end. So once they've done that again in December, we'll begin to see the differences in competence and competence levels as they've undertaken different activities.
Great stuff. Our proposal in the north of England started off in a very similar place, actually. We were planning on running a dementia pilot, but with the feedback we were getting from the organisations we were working with was actually this was going to be a bit difficult to do at this stage, and they didn't think the users would engage with it so much. So we decided to take a step back and ask the organisations what they thought the key issues for them were. And one other thing, the pieces of feedback we were getting was that patient care was really important. So historically we've called that bedside manner. So it's the way your doctor, your nurse, your paramedic treats you when they're attending to you. Our pilot works in a very similar way. We looked at it from the point of view that a user has a menu of content they can access. So we're still using things like the bookmarklet to capture learning resources like YouTube videos, but we're also capturing various elements of e-learning as well using the Tin Can API. So the screenshot here shows a simulation that we created. So this is a virtual story of some characters that we videoed. We put them into a scenario, and we actually got them to then interact in the scenario, and we got learners to reflect on that. So the reflective element is a really important part of that, and we capture that through a product called Lectora, which is a learning authoring tool, and that allows us to actually generate the Tin Can statements that then go into the learning record store. Our pilot technically isn't as far ahead as Alison's, but we are still making fantastic progress, and the feedback we've had from users so far has been really positive. This chart here shows. This chart here shows kind of what we were expecting. So just like Alison, at the start and finish of our piece of learning activity, our set of learning activities, we were getting learners to benchmark themselves against a set of criteria. So this was the bookmarklet checklist app. We get people to assess their confidence and competence in whether they think they're excellent at patient care and whether they think they've got the abilities to actually deal with patients in that respect. What we're actually hoping to see is a negative correlation when they assess themselves at the start of the set of learning activities to when they assess themselves at the end. So hopefully we're expecting them to assess themselves quite highly at the start, and after they've reflected on the learning activities, we'll actually find that there's a negative correlation and they start to assess themselves a bit more realistically, which potentially could be lower than they had before. Alison?
Okay, so to actually get to this, there were many months of grappling with the new possibilities that Tin Can could offer, mostly honing down our ideas. But throughout this Watershed First sort of program, we've been lucky enough to be coached and challenged by Russ C using what they call their Watershed method. We had to develop our thinking, and we had to challenge ourselves not to be attracted to just collecting data for data's sake, but considering the question that we wanted an answer to first, and then to develop a hypothesis and select activities and the resulting data to help prove or disprove our hypothesis. So a fairly sort of standard research approach, really, I suppose. But certainly, the question coming first, the data and the data then providing the answer. So in our case, our question, do people who take advantage of more types of learning activities have higher confidence and competence levels after participating in those activities? And our hypothesis being that actually, if they're participating in distinct types of activities and more of them, then it will make them more confident and competent. And as I've outlined, the activities range from sort of simulation, e-learning websites, online stuff, and workplace assessments. I suppose we kind of went for the stuff that we knew we could get some sort of capture for, and we could technically enable early on in the project, really. Okay. So good old Einstein, absolutely right. Not everything that can be counted counts, and not everything that counts can be counted. We've been challenged to think really hard about what activities make up the learning offer, and not to simply measure everything. So really just making a blatant point really here that we had to really distinguish between what would be valuable data at the end of throughout and at the end of our pilots, and not the silly data. The silly data, I suppose I'm thinking of here is the bums on seats, the number of people that are attending training. I mean, how's that important? How do we know really whether that's had any effect on workplace performance? So we're looking, hopefully we will find that we've got metrics that are actionable, that we can actually generate some insights and actions as a result of the metrics that we get, as opposed to the vanity metrics, the bums on seats type stuff.
So yeah, as Alison said, we set out with an intention of just tracking some learning, but Rusticity have really challenged our perceptions and our intentions over the last 6 months to a year. It hasn't been easy. We've had lots of very late night coffee fueled Skype calls, and they have challenged us with some very hard questions. But as we said right at the start of the project, if we thought this was going to be easy, someone would have done it already. So by working through this process, this methodology, we've come up with hopefully what we think is going to be the solution to some of these hard questions, and hopefully reach that holy grail that we talked about right at the start. Alison?
Okay, so it's a so what really. Quite often throughout this sort of project, and even when we were proposing the pilot project, I was questioned by people. Well, so what? You can capture all of that information. You can put it all in one place. So what? Why is that important? How's that any different to what we do already? In the case of our dementia pilot, if the experiment itself actually demonstrates that a specific learning activity has no effect, then we can reduce that learning activity, or in some cases we can stop doing it. We can discontinue that rather than carrying on down a path of just delivering training for training's sake. If the experiment actually substantiates that a specific learning activity is effective at increasing confidence and competence with dementia care, or even a specific combination of those, then we can move forward with that and really drive that through and promote that more. In fact, it's quite interesting in terms of our particular pilot already. As I've already mentioned, we've got the competence and competence survey that the staff will do at the beginning and end of the pilot. We have had some people already do that competence and competence survey a second time already, and even though they've done that in error, it's quite interesting to see that those early findings are showing that the more activities that those people have done, there's an increased confidence, but there's actually a decrease in competence. So very much what Richard was saying he's hoping to see with his project, in that there'll be a dip in people's competence after their initial high assessment of themselves at the beginning. So I mean, it's been kind of discussed and mooted here that actually that people have evidently moved from being unconsciously incompetent to consciously incompetent, which is actually, you know, a stage of learning, literally a journey of learning for most people in terms of their competency development. You will find that people dip first because they suddenly become aware that they were actually doing some things wrong.
And that's fantastic. That's exactly what we were hoping to get out of our pilot as well. The only other thing that I can add to this that we're already looking at as well is the next step and how we're looking to potentially correlate the data that we've got from learners with some of the patient survey data that we collect, the patient experience data, and see if this has any measurable impact on those kind of data. Are patients getting happier because we're training the staff? We honestly don't know whether that's going to be correct or not, but this is how we're going to hopefully achieve that Kirkpatrick level 3 and 4 and start seeing organisational change as a result of some of the interventions we're doing, the learning interventions. Alison?
So I suppose really the answer to the so what question is that the data has now become information. It's now become something that can generate actionable insight, something that is going to help decision making and increase the agility of an organisation that is very much focused on learning and improving performance of their employees.
Great. Well, thank you, Richard and Alison, for sharing all of that with us. I love this. I love this case study because it shows so many of the different capabilities that Tin Can's offering, and Richard and Alison really just dove right in and are really embracing a lot of this stuff. And they're not kidding when it says it's taken a lot of hard work to get through a lot of the hurdles. And we're just so appreciative of them and of all the other early adopters, many of whose stories we're now being able to share with the world for jumping in and getting on this journey with us. And so I'm going to go through now some of the few key takeaways that I have from hearing this story, and then I'll bring you through a little bit of what does this implementation actually look like, and we'll get into a little bit of the technical stuff as well. We've gotten some feedback from prior webinars that there's a few people out there who want to see some of the nuts and bolts. We're not going to make it too technical, but we'll get into just a tiny bit of that stuff. So key takeaways is looking at their story and listening. The LMS is only ever going to be part of the picture, and many organizations have many LMSs, and this is it's not there's no judgment about this. It's just the reality of the situation, and one that we need to adopt and embrace rather and learn to deal with. And I love Richard and Alison's attitude about this is going to be the way that things are going to work, and we need to find a way to bring all of the data together from all of these different sources and acknowledge the fact that we're never going to have a utopia of learning happening in just one system. That's just not feasible. It's not how humans work. Their situation too, where they have tons and tons of data that's currently being captured. I love the fact that they really want to take a dive in to know which learning is actually impacting all of their outcomes. A couple of things I love about this. They're not going in and prescribing the exact things to go learn about. They're giving people resources and letting learners go explore things, embracing that informal learning concept, and not trying to push learners in a certain direction, but rather letting them pick a little bit of their own path and explore on their own. And they're using a lot of different ways of doing that. I also love the hypothesis, moving from expecting that dip in self-perceived competence. It's one of those slightly counterintuitive things. You expect training to lead to more competence, but it makes perfect sense when you look at this model of going from unconsciously incompetent to consciously incompetent. It makes complete sense, and it's great to see the data supporting the models that we have over there. The other key takeaways come from the kind of the process side of things. The fact that we're still early days, and it takes time, and it's not easy, and it's a lot of work right now, but we're seeing great results, and that effort is actually starting to pay off. And after these early adopters blaze some hard trails for us, it gets easier for the rest of us to follow those trails and to learn from their experiences and to go down this path. And I think we've got the whole industry blazing a lot of trails that are going to make things a whole lot easier for people down the road and to be able to do some great stuff. I love their sentiment of we needed to narrow, and then we needed to narrow, and then we needed to narrow again, because so much of the success of these early projects is about being able to ask that specific question and not getting overwhelmed with everything that you can or could do, but focusing on one thing that you should do and can do right now. It's hard enough to get to the point where we've got that one thing to do without trying to boil the ocean just yet. We need a few more trailblazers before we're ready to go boil that ocean. And I also, love the sentiment about having the data being analytical, and that really forces you to ask some hard questions about what you're trying to accomplish and which training programs are being effective. Going into now, what does this actually look like? How has this manifested itself in reality? So here's just a quick screenshot of some of the accomplishments, the badges that the NHS folks are issuing to their employees over there. And I loved Allison's sentiment of let the learner own this badge. Let them have this accomplishment, take that with them as they go through different employers or even different sections within this one massive employer. It's such a progressive viewpoint for an employer to be allowing the learner to own their training and learning data, because really, as a learner, the things I do, they are inherent to me. They're kind of like my resume. They're the things that I have accomplished, and so they should travel with the learner. And we're now seeing the technology put in place to allow those things to easily transfer across organizational boundaries, which I think is really, really, really exciting. So they're taking a look at the different effects of activities. This is just a quick screenshot showing the change in confidence level for people. In this particular case, that there was no change in this graph over here, but just kind of giving you some quick visualizations of the dashboards that they're able to look at over here. And here's one of those dashboards where they're going in and trying to answer a specific question. In this case, the question is, does participating in more activities make people more confident and competent? And we're looking at the visualization. Say this person, these groups participate in these many activities, and that had this effect on confidence and competence, and you get a quick answer to that question in a concise visual format. I love the fact that, excuse me, they're using an example that we've been giving for a couple of years now of the bookmarklet. The simple way to have a button in your browser bookmark bar that you can see in the bottom left there where it says Send to LRS, a simple button that you can click and have whichever learning event you are currently experiencing tracked in your learning record store. The NHS is one of the first organizations to actually go out and use this in the real world for tracking real learners and real training, and to take it past the conceptual state, like this would be a great idea, to let's go make it happen. And it's really super simple to use. In the top left over there, you see the interface that the learner gets from the LRS, and installing the bookmarklet is as simple as clicking on that button and dragging it up to the browser toolbar, and then it just shows up right there, as you can see in the bottom left in the toolbar, and using it as easy as just clicking on that button when you are on a page. And over on the right there, we get to start to see which resources are being used by the learners, which ones are bubbling to the top, and we get a lot of information about all of this informal learning that the learners choose to have tracked for their dementia training there. So here's a quick dive into the technical stuff. So TinCan is great, but we have a little bit more work to do. And we have more work to do specifically around bringing together, or bringing us all together, to use common sets of vocabulary, use the same terms to describe the same things. And there's two key technical enablers that are being put in place right now. They're the registry and the recipes. The registry is the concept of, TinCan has this notion of, we use the I did this, the actor verb object structure to record events. Well, being that descriptive, there are many ways to describe the did, the verb, and there's many ways to describe the this, the actual object. And so there becomes this need to have a registry to go say, when I say this, here's the thing I am pointing to, so that everybody uses that same identifier, the same way of pointing to that same object. Another key technical evolution that we continue to drive forward is the notion of a recipe. And a recipe is a set of best practices for defining how to report on a set of activities. And so, some of these were born out of some of our early work. Internally here at Rusticy, we're a small company, and we wound up doing 3 video projects, and we wound up using 3 different ways of reporting on the fact that somebody watched a video. One would have Mike played video, another one would say Mike watched video, another one would say Mike viewed video, to use a simplistic example. So there's this notion of, as an industry, we need to be developing best practices around how to report on different sets of activities. Video is one. And then one you can see highlighted over here is, what are the best practices for using TinCan to report on a performance observation checklist? And so NHS, as an early pilot project, is taking the lead on some of these technical implementations as well, and technical best practices that I think are fundamentally important for the long-term success of TinCan as we go forward. Another key capability that they're actually taking advantage of, and we're starting to see more and more organizations start to need, and it's another acknowledged shortcoming of TinCan that needs to be solved by the tools out there, and we're trying to do that with Watershed and others, is this concept of actor merging. And on the screen over here, you see 2 different ways of identifying me. You've got my Twitter handle, @Mike_Rusticy, and you have my email address, mike@scorum.com, but they're all just really me. And again, going back into that flexibility of TinCan, there are many different ways of describing the I in the I did this. A learning record store needs to be smart about its ability to consolidate the different descriptions of an actor, of an individual, and put them into one person, recognize that they are the same. And since we had so many different sources of data coming in over here, we actually had to solve that problem early on for the NHS. That's out there and live, and kind of cool to see that working. So I know many of you who come to these webinars have been to a few of them before, and you've probably heard me speak, or somebody else here speak, and talk about how people are kind of reconceptualizing the enterprise learning architecture now that TinCan enables us to disaggregate systems. And you may have seen this diagram, which shows an LMS which has 50 different sets of functionality, but 2 core pieces. The learning record store that we've all probably heard about, and then something we also call a training delivery system, the thing that kind of pushes content out. And you've probably seen a slide like this before as well, where excuse me, we have a learning record store sitting at the center of the architecture, a training delivery system to push out formal learning, and then we have all of these different sources of learning data integrating and sending data into their best-of-breed tools for each of these things. Well, yeah, I loved going through the rehearsal for this webinar and seeing Allison's slide over here, and I said, I like this, and it kind of looks pretty familiar, where we have all of these different learning events. She has the learner in the center over there. But I had Jeff then go ahead and let's merge these two diagrams. And I love seeing essentially this vision coming into reality. We've got on the right there our performance observations for workplace assessment surveys. Mobile's being used to capture a lot of the data coming from the simulation. We've got the actual real-world activities that simulation is, in the real world over there. All the informal resources coming in via the bookmarklet, and the formal e-learning stuff that they're using our SCORM Cloud to deliver as a TDS in there. It's great to see these, this kind of new vision of a way we can use best-of-breed tools and a variety of different tools to deliver training actually coming into being. So with that, I want to say, Allison and Richard have been very gracious enough to offer up the content information and to make themselves available for further questions or discussions if you want to talk with them in more depth. There's my contact information as well. I'm always very eager and willing to talk about these things. It's pretty much what I do, and I can geek out about tin can stuff all day long and twice on Sunday. So feel free to reach out at any time. And as an organization too, we love to talk. We'd love to talk to you about how this technology might work within your organization. And we often will do a full 1 hour session with your learning and development folks, your technical folks, if appropriate, and sit down and take a really deep dive into how this technology could impact your organization. Kind of Tin Can 101, the impacts of this on the entire industry and how that might impact your organization. It's not a sales pitch or anything along those lines. Just help you understand all of these changes that are coming. And there'll be a survey that pops up here. It might be up already. If you're interested in doing something along those lines, just let us know. We have another webinar coming up, tincanapi.com/webinar. This one is going to focus on a case study from Pandora, the jewelry company, and our partners Tribridge, and how they are using Tin Can to correlate training with actual employee performance data, the sales data from within the store over there, and doing so in the Cornerstone ecosystem as well. So we'd love to have you join us for that. There's the URL, and I'm sure you'll get an email reminder of that as well. And so we've saved a few minutes for questions over here. Just wanted to go ahead and say thank you for attending, and appreciate your time over here. And I'll go through they're sending me some questions over in the chat window over here. I will take a few of those and maybe wrap up a little bit early as well here. Let's see, they're coming in fast. So go right up to the top over here. So where was Watershed LRS hosted and by who? Watershed LRS is a SaaS product that we maintain. It's hosted by us. We've used the Amazon infrastructure for all of that, but it is a SaaS product. One of the things that I saw early on is Tin Can's various blogs with security issues. Is this still an issue? Security issues have never been a huge topic of discussion in so much as unique security issues because of Tin Can. The security issues inherent in Tin Can are security issues inherent in any generalized computer system. However, there are a lot of issues about privacy and a lot of concern about where does this data go, who can access it. The portability of data inherent in Tin Can implicitly then raises privacy concerns. Anytime data is movable, we need to have best practices and such around privacy. And especially as we're crossing over into Europe over here in the UK, they have a very different notion of privacy often than we do here in the U.S. And so I do remember there were certainly some. I think Allison had to move some pretty serious mountains internally to get this project off the ground. And the privacy issues that we're seeing aren't so much, they're not technical issues. They're not, flaws or vulnerabilities so much as they are a need for best practices. We're not collecting any data that we couldn't otherwise collect, and we're not moving any data around that we couldn't otherwise move around. We just need to make sure that as we use the tools that make it a whole lot easier, that we follow the same best practices as we would if we were just manually handling the data. So do all the learning statements reach the LRS via SCORM Cloud? No. So SCORM Cloud actually has its own learning record store in it that is free for people to use, as production ready and everything. But it also has the ability to deliver SCORM content and then save all of that training data, the SCORM data, into a tin can learning record store. In this case, the SCORM Cloud is delivering the SCORM content and then forwarding statements over into the Watershed learning record store. But all of the other direct activities are sending data directly into Watershed. Let's see what else we have up here. Did NHS use Watershed to track the data, or did NHS use Watershed LRS to track the data, or are they using their own LRS? They're using Watershed. Let's see here. Let's go ahead and take one more. How are you authenticating users from mobile devices when attaching to the LRS? That's a good question. I don't have the answer to that. Richard or Allison, do you have an answer to how you're authenticating users from the mobile devices?
With the stuff that our staff are accessing via mobile devices, like the assessments and things, those are actually built within the LRS at this time. Richard, I don't know whether you're further ahead with regards to what's what your activities will be like via mobile.
In terms of what we're trying to do, I've already mentioned the product called Lectora, which is one that we're using to do a lot of our data capture, and that generates its own tin can statements. So in terms of that, we've actually just provided a field when the learner accesses the learning to enter their email address, and that's our unique identifier that gets sent to the learning record store.
Cool. So as an independent e-learning designer and developer, I embrace the tin can concept, but I struggle with how to get my clients on board. Any suggestions? That's a great question, and one we very much are thinking about as well. So what we tend to find resonates well is the ability to do something new. And this isn't something that you can often go push somebody into. It's often when they have a need that can't be met with traditional means, then that's the time to introduce the technology. And we're always, as we talked about earlier, starting narrow and starting small. So let's go. For one client, it might be they want to do something on mobile, or they want to just track a simple real-world type thing. Those small things are much easier to introduce than saying move to a full-on learning record store-centric architecture and go whole hog into everything. It's always about starting small, connecting narrow things to solve specific problems. We often have a lot of success introducing both the technology in a small way and that scientific method, analytical way of thinking that we espouse with the Watershed method. We're coming in, so we're going to try to answer a question, and those seem to be the keys so far. And if I knew how to get every organization to adopt, then we'd be a whole lot farther along than we are right now. I think we all have to kind of just work together to spread the gospel and get people excited about things. And if you figure out how to get everybody on board, absolutely let me know. I want to hear it. So we have time for maybe one last question over here. How do you track offline activities such as workshops to incorporate into the LRS to evaluate the learning curve? And so I assume this is from a technical perspective. How do you actually track the offline activities? And I think we heard them say they've got an iPad that they're using to get a lot of that data into there. How do you evaluate the learning curve? I'm not exactly sure what that question is. We'll dive into that a little bit more in the offline Q&A. So I don't see them feeding me anymore, so let's go ahead and we'll get you out of here 2 minutes early. We'll go ahead and wrap things up. Again, thank you very much for coming. A big thanks to Allison and Richard for joining us and spending so much time to put this together, and most importantly for being gung-ho early adopters of all of this technology and bearing with us through those late night Skype sessions and caffeine-fueled discussions.
Thank you, Mike.
So thanks, everybody, and I hope you have a good rest of your day.
Thank you. Thank you for listening.
Thanks, everyone.
Goodbye.